So, as you know, it's Krishna Marian speaking from the Good to Go Transition Program here at SickKids. And in terms of the presentation, please don't feel like I put a lot of work together to put this. This is really just cut and paste from the number of different presentations we do within our hospital, actually, and sort of outside in the community. And just to kind of give you the bit of the background, we're often requested to provide information on our program, but also at the same time, obviously, educating people on the world of transition. So this is sort of bits and pieces of what we would present to either a healthcare provider, a family, to patients, to people who are very well versed in the transitions world, as well as people who are very new to it. So it'll be at a different level depending on sort of your own background. So, you know, essentially we're quite interested in preparing patients to be good to go, and we also talk about kind of being ready to grow. Given that we're in a pediatric institute, we sort of feel like we can only work with young people up until about the age of 18. Lisa, go ahead. You can advance the slide. So we often start by talking about what the goal is of our overall program. And in the last 6 years now that the program has existed at SickKids, we'd identified some very particular goals, and they really were about helping all young people who have any kind of chronic health condition at SickKids to leave by about the age of 18. Of course, we wanted them to have a few key skills in terms of being able to advocate for healthcare, be able to sort of maintain appropriate health behaviors, and ultimately use the adult healthcare services appropriately. And we're really talking about the transition from a family-centered to a patient-centered care facility. The image on the right is an example of one of our reminder posters. It's a small initiative, but essentially we developed posters to be posted throughout the hospital in ambulatory areas, just to remind families, patients, as well as healthcare providers that we have a responsibility to prepare young people to graduate to adult care. Okay, go ahead, next slide, please, Lisa. Regardless of who the audience is when anybody from our team is speaking about transitions, we always start with a description of the definition and understanding the key difference between transition and transfer. And even over the years, I've seen many healthcare providers really mix this up. We know that preparing for transfer is important, but transfer is really that one-time event, while transition is really that process, the idea of kind of growing up ready. We've all seen this definition before, but again, I really want to stress over and over again that sometimes we're really talking about transfer, but we think we're talking about transition, and often the vice versa as well. Next slide, please. So again, a common thing to explain in any of our presentations is really about sort of what's all the fuss about. When I meet with families, I often say, why do I have a job? And in essence, you know, I'm here at SickKids 4 days a week. I've got team members that include a clinical nurse specialist that's here 5 days a week. That's Geraldine Cullendean. We've got an OT now that's part of our program, not necessarily in an OT role, but is there with us 3 days a week, and we have Miriam Coffin, who's a pediatrician, who's there with us, I'd say, about a day a week. And we're paid essentially by the hospital to provide consultation services within our system and sort of outside at times. And I sort of say to people, well, why do I have a job? And we talk about some of the key things, and it's often presented as like, what's all the fuss about? You know, why are we even getting together even as a community of practice? And the key things that we always remind people of is that young people's special health care needs are growing, and it's a growing population, and it's, you know, with the technological and medical advances, this is only going to grow. We remind people that we have some evidence that transfer is kind of risky business, that we don't have a ton of guidelines in development or ready even to help with young people around transfer specifically. I usually talk about the differences between the two cultures, the pediatric and adult healthcare systems. And when I do talk about this, I often try to stress that things are different, not one being good and one being bad. I know that over the years we've come to learn that, unfortunately, our adult counterparts kind of get a bad rap in a way. We talk about some of the differences, which aren't always positive, but we don't highlight that there's a real benefit to transferring into the adult system. You know, at the end of the day, the adult healthcare providers are experts of the adult body and brain, and our young people deserve to have experts taking care of them. So that's kind of the message we often talk about. And finally, I usually highlight or talk a little bit about the different stakeholders involved, which includes, of course, the teenager who has a teenage brain, the parent or the caregivers, the pediatric care provider, and the adult health care provider. So typically, at this point in a presentation, I would sort of go over each of these things in a little bit more detail. But since I'm, preaching to the choir, I won't. But some of the key things, as I said, we talk about the different cultures. We talk about the evidence that says transition can be challenging if you don't, support it. And when we talk about the differences between the different stakeholders, usually highlighting things that young people often do feel unprepared or indifferent about transitioning. Parents can feel scared, worried, and adult healthcare providers are often frustrated. Those are some of the things I often highlight in there. When we talk about the teen brain, we really just remind people that the teen brain is under construction. We see periods of true maturity around 15, 16, 17, 18, and then we see true areas that look like deficits, but are actually just normal developmental things. So up until this point, are there any questions?
I love the way you have phrased that, Coach.
Thank you. Had lots of practice with this presentation. So we really talk about using something called the shared management model. Again, I think most people would be familiar with this. I really like the way this simplifies our ultimate goal, right? And our ultimate goal is often to shift responsibility of care from provider via parents and family and ultimately to the youth. So you can see that highlighted section, the purple section of this table, talks about the youth being supervisor, CEO eventually. At the same time, the parent is still available to them as a consultant, and the provider's there as a resource. And this is sort of age and time. I like that this chart doesn't have any actual ages or any demarcations in that way, because truthfully, the supervisor, CEO of a youth might not happen until the person is a young adult or an adult, right? I often use this model with healthcare providers, and I've even integrated more in my actual clinical practice with young people, sort of sitting down saying, hey, what do you think you are right now? Are you a participant? Are you a manager? Is mom definitely the supervisor? Is your healthcare provider really the leader? And how do you think you can get to the other side, right? So people buy into this. This is sort of a familiar concept. All right, go ahead, Lisa. So what I figured I'd do for the rest of this little presentation is talk about some of the different tools that we have. And again, if anybody spent any time fooling around on our website, you've probably seen different versions of these. I sort of apologize. I don't think our website is in the best order or even sort of organizational capacity. We hope that we can change that over time. But we do have a number of tools that we think are available and useful for everybody, all stakeholders. We have some that we think are really geared toward the parents, some that are really geared toward the young person, of course, some that are really geared toward healthcare providers. So this is kind of a mishmash of the different things. So as I've hinted at, the transition reminder, that poster, is one that's available. We probably have it in, I think, at least over 30 or 40 different clinics in the hospital. We hope that it helps kind of trademark the idea a little bit about transitioning being something that everybody's responsible for, but Good to Go is available to support young people. And healthcare providers, of course. Then again, and there's a reminder for our website. So go ahead, Lisa. So here's some of the different tools. I will go through each of these in a little bit more detail, but we've got the My Health Password, the 3-sentence summary, and each of those have their own sort of bookmark reminders. We've got checklists. We've got booklets that talk about getting ready for adult care. We have different events related to transitioning, getting ready for adult care. We have information nights, and I'm using an example of another website that's very specific to young people with HIV. Okay, go ahead, Lisa. The My Health Password, if you haven't seen it before, it's sort of this customizable wallet-sized card. It's something that a healthcare provider can help a young person complete, or the young person can do it on their own or with help from a parent. It's really about gaining ownership of healthcare status. So we know in the literature that a portable health summary is essential to support and of course is believed to be useful in transition preparation. There are, of course, a number of different tools out there. Here's an example of what the website actually looks like in the different templates that are available. And even this is a fairly old snapshot. Now we have upwards of 40 different templates. There's always a generic passport that can be used. There's a mental health passport now. There's developmental delay. We're trying to make it as exclusive. There's even an education passport, actually, for young people who have learning disabilities. And essentially the idea with the passport is that when young people complete this, they have some ownership of their health information. Maybe they first do it when they're 10 or 12 with a parent, and parent is responsible for making changes, stating it. But over time, we want that young person to kind of know their history, want their health condition to be their story. Anecdotally, we get a lot of feedback from users that it has been useful, that they take it to the healthcare appointments, that they show it to healthcare providers. And then in terms of the transition world, that the adult healthcare providers are pretty impressed when a young person walks in with something like this. So it's free. If anybody ever had a suggestion or an idea of a template that does not exist, we're open for business in that way. We love people to give us ideas and support us in developing that. It's not very hard actually to make one. And it's been around now for about 5 or 6 years. And we're hoping, the next step is really to go mobile with it, right, so that young people can be accessing and updating this on an app, for example. Go ahead, Lisa. Another tool that we've developed, we modeled it off for something that Helen Bloorview had, was the idea of using a timeline. The timeline really is, as you can guess, a summary of information over a period of time. So we talk about the growing up of a young person in a number of different domains, like their social domain, the self-care, education, as well as medical, and starting kind of right from birth or diagnosis, right over until about 16 to 18 years of age and beyond. And we like the idea of something like a continuum to show young people and to show parents that your child, even when you're looking at them when they're 4 years old and they have this complex medical condition, is going to grow up to ultimately what we hope is going to be what's it called? As independently functioning young person as they can in terms of managing their health care. So the timeline, there's a couple of examples just on the next few slides. You can go through those. Yeah. So here's one from Hirschsprung disease. So a group of people from this particular clinic, it was a general surgery clinic, sat down, looked at some versions of different timelines that exist, put together the things that they thought were still generic enough and would apply to their population, plus the things they thought were very specific to their population. And those usually go under the medical category. So we support programs within the hospitals to develop their own timelines. And of course, these timelines can be used in a number of different ways. Families can take them home. They can be introduced to it by healthcare providers at different time frames. They can be posted in clinics in large formats. They're available online. Again, we want this to be up there multiple times. We had a short survey that went out with the timelines, just asking for feedback about what people did. Fortunately, we got very few hits, so we don't really know if young people or adults actually look back at this once they've initially received it. Hopefully, we'll know that in the future. You can click through these if you like. Three-sentence summary was developed as an idea of easy intervention, really a way to... Three sentences essentially come down to the first sentence being having the young person be able to describe their age, diagnosis, medical history. Second seems to be about their treatment plan. And the third is really about what they're hoping to access or get done during that current visit. The idea behind this is that we know that our adult healthcare providers are busy. They have less time than the pediatric providers, and they have less of a relationship initially with young people as they enter the adult system. So we practice things like a three-sentence summary in the pediatric system where it's safe, where young people can't really mess it up, and have them get ready to do this when they get to the adult system. Again, we can imagine a healthcare provider would be really not only just impressed, but grateful for something like this from any of their patients, let alone their young person, who comes in with very clear, accurate information and a goal for a particular healthcare appointment. So the image you see on the right is an example of the bookmark that we have floating around so that young people can kind of take it with them, that we can walk it through them, and introduce it into this idea. Go ahead. The readiness checklist is just one of the versions of the multitude of checklists that are out there. We adapted it to try and make it a bit more applicable to our broad population, and also to make some changes based on feedback and using the different versions over the years. We wanted young people to provide their own assessment of their medical knowledge, their autonomy, and their ability to manage their health. with some really concrete things like I know the names of my medications, I know how they're paid for, I can make an appointment, I can talk to my healthcare provider on my own. We haven't used it in a systematic way in the terms of sort of, summing up scores or anything like that. I don't know how valuable that would be, and I'd be curious to hear what other people's experiences are with this. But we often use it as a tool to support transition planning and a bit of an evaluation of change over time if we have an opportunity to complete it more than once over the course of a relationship with a young person. The thing that I think that's a bit unique that we've tried to do is have a parent version of the same checklist where parents are actually providing their perspective on where their young person's at. Again, we don't have a lot of feedback on the validity of this. It's not that different than the versions that are out there that do have a bit of validity. And again, our next steps might really be about either simplifying this or really testing out whether it does what we hope it does, which is test where a young person's at and give us ideas about what to do next. Go ahead, Lisa, please. One of the models that we sort of present throughout the hospital is the idea of encouraging solo interactions. So encouraging clinics to set an age where they see patients without parents or at least part of the visit. We have some, evidence that this is going to help with communication, self-reliance, and ultimately comfort with healthcare interactions. And of course, that opportunity to disclose confidential information. So we had feedback from young people saying they really do like the chance to see the doctors and the nurses without parents. One thing that I sort of forgot to mention at the beginning, It's Good to Go is housed within the adolescent medicine department here at SickKids. And that gives us sort of a bit of a benefit, actually, because we work within a model of adolescent medicine care, which is really about supporting adolescents having service delivery in the way that makes the most sense for them. So, sometimes we can say to a clinic, fine, if you're worried about doing this, just pick an age. Say, oh, you're a teenager now, you're 14, you have to be seen for 5 minutes on your own. Again, if it's in the best interest of the young person, or always on your own unless you request otherwise. Go ahead, Lisa, please. Booklet on the side here, example of a generic booklet that describes the differences between pediatric and adult system and ways that young people can get ready. We encourage groups in the hospital to develop kind of like their own insert, and the insert really would describe the specifics about transferring. Sometimes the really basic stuff like where's the hospital, what's the phone number, who do you contact, what do you do if care providers, who do you go, what emergency room do you go to. Again, we support programs within our own hospital in terms of customizing those inserts and ways to sort of distribute this and make it useful for young people. We've recently done a revision with Holland Bloorview on a spina bifida version. So we think we've got some great new information that we'd like to include. Hopefully we'll get to revise this and get it up to date soon. That sponsorship from our one of the Women's Auxiliary Program within SickKids, so we're fortunate to be able to have this booklet printed and ready to go for a large group of patients in the hospital with no cost. So that really is valuable. As a program, we don't necessarily have a budget that we're allotted to each year. I mean, the true cost of our program is salary support of me and my team members. And so in terms of printing and pulling together these pretty looking posters and fancy things, we often get either the clinics that we're supporting in paying for them, or through charitable, fortunate to be somewhat successful through our own SickKids Foundation to have big money sometimes in supporting things like the My Health Passport, which is, imagine, a cost ever, or things like the booklet, which even over time does add up with printing and that sort of thing. Go ahead, Lisa. We've tried to support programs also in devising something we've called an orientation to adult healthcare, and it can come in a number of different ways. It usually includes a group event where patients with a similar condition of some sort, maybe they're all just cardiac patients or they're all gen surge patients, who will likely be going to the same place in the adult system. And it gives them the opportunity to meet adult healthcare providers, to do sort of They may create a My Health Passport. They often get detailed letters about their transfer. They may get a graduation certificate, and it's kind of a natural opportunity to say goodbye to pediatric care providers and normalize the whole experience as being, you know, a big change in their life. So we, again, as a program, Good to Go really tries to help other programs here operate and provide these kinds of services. You can imagine for the busy healthcare provider who wants to do something like this, having to do it on top of all their other clinical duties, it can be really challenging. So we try to facilitate ways to make this easy, help with facilitating the groups, you know, helping make partnerships with the adult teams. Again, we've had feedback over the years that young people really appreciate this. The adult care providers like to be part of this. It gives them an opportunity to tell healthcare providers here as well as families what their expectations are. And then the pediatric providers really like it too because they can, you know, kill a couple of birds with one stone in a way. So go ahead, Lisa. We also, just in this past year, devised something we called sort of a teen night, or a Good to Go teen night. We wanted to have an opportunity for young people to come that were not asked to come because they're part of the same, they have the same condition or disease group. So this was sort of open to anybody who had a health care condition that is about 13 and up. And we tried to make it sort of a fun, game-like night where young people could earn a good incentive, as well as kind of learn a little bit about getting ready to transition. So it's sort of the introduction to transition. We had a bit of success with it, but a big challenge with really getting young people to come and commit. You know, it was an evening. We tried to have all sorts of incentives. We did a lot of advertising. We asked healthcare providers to recruit for us, and yet over time we probably still only got about no more than sort of 10 young people over the course of the whole year, which is a big investment at that time, month per month. But at the same time, I think the young people who went through it did enjoy it and give us good feedback about it. So we'll see whether we do something like this again in the coming year. Okay, next slide, please. A couple of the little tools that we use are things like a graduation certificate. It seems kind of like a small little tool, but essentially, we get feedback that young people do appreciate getting something that's signed by their healthcare provider, some of which they've known their whole life. And the whole idea is about reframing the idea of leaving pediatrics as an achievement versus sort of feeling kicked out or let go in a way. Talk about it sort of celebrating them leaving. When I've worked with young people independently, you know, in a transition clinic way, which I'll describe in a second, we often sort of make a party out of leaving so that they do have the opportunity to meet with their healthcare providers, take pictures, sign little guest books in a way. Those are all little cute things you can do, I think, to help young people feel like they're graduating and closing a chapter versus feeling they're being kicked out. Okay, Lisa? Another tool that we've developed, but we'll be revising actually, for adolescents with complex care needs. And so this is probably one of the only things we really have that's designed for the young family of the young person who's not likely to be leading their own care. As you can guess, sort of all the tools I've described so far are for the young person that we suspect could be able to manage their own health care in time. This is a tool for the parents that are really going to be leading their young person's care before and after the transfer event from pediatrics to adult care occurs. It's really about being able to summarize and put together some of the different concrete things that parents need to do and know about so that there's a continuity in funding or respite or whatever else we need. So we want these families to feel confident. You know, we have evidence that they're not comfortable with this transition process and that they experience it with even more challenges than the normal youth with a chronic health condition does. Okay, Lisa? And finally, we have something that we call the Good to Go Transition Treatment Clinic. So these are the referrals we get specifically to our program for patients that have really kind of complex issues. Usually they're medical issues that require a lot of care. There might be some non-adherence there. There might be psychological factors that are suspected to interfere with their transition. These are sort of the young people that we have pretty ample evidence that their transfer is not going to go well, maybe because their care right now isn't even going very well, or that they're scared or they're really hesitant to engage with the adult system. So we have the opportunity to work with these patients in a really flexible way. You know, after doing an assessment, we may do weekly therapy, we may do, you know, education, we may do case conferences. We don't have one protocol designed. And again, because there's no real guidelines on what to do, we sort of do what we think is in the best interest of the young person. Sometimes things that we would do with the patient at clinic is develop their MyHealthPath, or practice the role-playing of a solo interaction or a 3-sentence summary, or walk with them to the adult care site and kind of explore and talk to different people there. Okay, next. And finally, as I said, there's an example of another tool that we've helped others develop, which was, this is for the HIV group here at SickKids. They've developed their own Good2Go website, or sorry, their own transition website that describes all the different things that young people should know about or can learn about around the time of transfer. Of course, this is useful for somebody even before they're in the transfer period. One of the things I really like about this website, and the link is there if you have a chance to go to it, is there's a description of the different services that young people can choose from to get their HIV care as an adult. And it highlights some of the key differences between the pediatric and adult systems. So, for example, one of the things we often do here to encourage young people to come is we literally give them like TTC tokens, which are tokens for our transit system here in Toronto, so that they will make it to appointments, because some of the barriers sometimes is I can't afford the $3 to come down here. So we find ways to get them support or pay for parking or whatever it is, you know, and that's very unlikely in the adult system. So the website just simply sort of says, you know, oh, look, SickKids does that, all these other places don't do that. Sort of like be aware, be prepared in a way.
Mm-hmm.
So again, we had some funding to help develop this website. We don't have much information about how many hits it gets or if young people are using it, but we quite like it, of course. And then finally, you often, you know, and any presentation about with some of the guidelines for groups that are trying to prepare young people for transition. So really about forming a team, right? I know one healthcare provider can do this alone. The idea of doing a planned and coordinated approach, developing it at an early pace, and of course doing it at the youth pace, correcting misconceptions and cultivating positive attitudes to adult care, meaning the healthcare providers, the service system, the graduation concept. And then, of course, because we're a developing program, we really want to encourage young people to evaluate the transition practice. So we try to always talk about different ways we can evaluate what we do so that ultimately we can help build the evidence-based practices. And you might be evaluating all sorts of things from readiness to actual success with transfer to adherence to satisfaction, quality of life, morbidity, mortality. I mean, the list sort of goes on. We don't have one appropriate transition outcome. Okay, next. That is it. There we go. So the quick and dirty version of our program here. My contact information there. I'm happy to share these slides if people find it useful. You can email me directly. I can just send off what you think would be helpful. I think almost all of it is there in some format or the other on our own website. As I said, we're a program that's been around for about 6 years. I've been in this position for about 2 or almost. And you know, we're not growing in the sense of our team expanding, but although we'd love to, but we are growing in terms of I think the needs we are trying to meet and the impact we have for other programs outside of SickKids, such as this community of practice. Thank you. Any questions? Do we have some time?